Hey again. So, still chapter 15. Next, we talk about depressive disorders and bipolar disorder, right? So, you have major depressive disorder, right? Major depressive disorder. And maybe this is a good time to remind you, right? You have that DSM-5 that lists all the disorders. And so, when you're looking at an individual, right, a client, patient, that's having having problems, you'd look at that, right? And the DSM is going to list all the possible symptoms of the disorder, and it's going to say a certain number of those symptoms have to be there for a particular period of time to diagnose the person with this disorder, right? So they say that here, right? So at least 5 signs, at least 5 of the symptoms of depression must be there, and they must last 2 or more weeks, right, before you diagnose someone with this. Or that's the guidelines, right? Once again, of course, as I said in an earlier video, who knows if the person who's diagnosing them follows those guidelines or not, right? It's kind of an art rather than a science when it comes to diagnosing people. And that's the same with just your family doctor that you go to. I mean, they just look at your symptoms and think, well, most likely you're experiencing this cold that's going around. That fits in with your symptoms, so we'll just do this, right? But once again, it's an art. They're guessing, right? 2 weeks later, you still got it. You have to go back. They have to relook at it, right? So, yeah. So that's what we're doing here with disorders, right? So major depressive disorder, yeah, this is the major one, right? So they got a variety of the symptoms there they mentioned. I think we all kind of have a sense of what major depressive disorder or major depression is. So yeah, difficulty concentrating and making decisions, feelings of hopelessness and helplessness, poor self-esteem, reduced energy levels, right? Problems sleeping, and problems regulating their appetite, and just depressed mood most of the time, dramatically reduced interest or enjoyment in activities they used to enjoy and do, right? So you got a variety of these symptoms, and that's by no means all of them, all the possible symptoms, right? So yeah, it changes the way the person lives, right? They used to be normal, now they're like this, right? Now they don't find any enjoyment in doing things they used to do. They don't go out with friends anymore. They're more reclusive. They're tired all the time, and you can go on, right? So yeah. Now, major depressive disorder, I dare say most of us at some times in our lives could be diagnosed with this. But should we be? That's another question, right? I mean, obviously, a loved one dies, you're going to be depressed. And that might be for 2 or more weeks. Now, do you seek help from a doctor or psychiatrist to get medication for that? Right? That'd be one. Another way of looking at it is sometimes depression is natural. Right? We all go through it. We all experience it. And this could go back into the debate I mentioned earlier in this chapter about, overdiagnosing people. I mean, if someone's spouse of 40 years has just died and they've been depressed for 4 months, that makes sense, right? That makes sense. Should you diagnose them with a disorder for that? But that gets back into that controversy a little bit. So things are not always as clear-cut as you might think when it comes to psychological disorders and diagnosing them and all that kind of stuff. So we've said that before. Then another disorder here is obviously bipolar disorder, right? Bipolar disorder. And in bipolar disorder, there's going to be a history of at least one experience at least of each of these 2 states in bipolar disorder, which would be depression, and the other would be mania, right? Mania. So like they say here in the book, right? Mania is a hyperactive, wildly optimistic state in which dangerously poor judgment is common, right? So someone in a manic state it's the complete opposite of depression, right? They feel fantastic. They might be able to go for a week without any sleep. And they got tons of energy. They think everything they do is fantastic. Now this is not true. All right? They think everything they're doing is fantastic, but that's not. Once again, they might be mistaken about that, right? Stuff they do might be crap, but they think is oh so wonderful, right? Let's see. So yeah, and then there's the negative side of feeling invincible. You know, not thinking about future consequences. You know, you might max out all your credit cards. You might have sex with multiple partners with no protection, right? So they're negative things that can come along with mania. It sounds fascinating to me. It'd be interesting to experience a manic state, but yeah, they make terrible decisions, right? Terrible decisions. So anyway, so bipolar disorder, you have at least a history of having one depressive episode and one bipolar, one depressive and one manic episode. But once again, for each individual person with bipolar, it's going to be very different how this disorder manifests itself, right? Somebody might have more depressive episodes and very few manic, or it could be a lot of manic episodes. It just depends on the individual patient, right? So anyway, that's kind of the gist of bipolar disorder, and yeah, they talk about maybe some artists in history had bipolar disorder or milder forms of it. They mentioned a few composers there that composed a lot during what today, looking back on them today, looks like manic episodes, and then depressive episodes where they didn't do anything. So bipolar disorder may have some relationship with creativity in the arts area. But remember, they're going to think everything they're doing is amazing. Objectively, it may not be. All right? So anyway, they also mentioned that maybe more boys are starting to be diagnosed with bipolar disorder than women. But by means, major depressive disorder is much more common in women than men, though. And they mentioned that in here. An important thing in their discussion here is that just women are more vulnerable to disorders involving internalized states. So all those anxiety disorders are more likely in women. Major depressive disorder is more likely in women, right? Us men take a different route, right? Right. We got more problems with drug abuse and personality disorders. So. Yeah. Anyway, so let's see. So then, they just talk about understanding depressive disorders, bipolar disorder. Give you a bunch of these different facts, that basically just depressive disorder is very common, right? Not as common as phobias, they say, but depression is the main reason people will seek help, right? From psychology or psychiatry. So they do mention that, and yeah, so I mentioned the gender gap, they call it there, right? More women have major depressive disorder than men. That could be a bit of a genetic thing. It could also be, and must also be, partly due to just the circumstances, the increased, more stressful, more unpleasant circumstances that women experience than men, right? So yeah, they've got increased stress, like they say, in here. Basically, women, still don't get paid as much as men for the same job. They're the ones who have to juggle multiple roles, right? They have to be at work, they have to take care of the kids at home, they have to do the washing, they have to do all these various roles much more often than men have to. So yeah, and women are more likely to be the victims, right, of physical and sexual abuse. So there are a lot of possible environmental factors, right, that also lead to more women experiencing major depressive disorder than men. And they go on and talk some other stuff here about, obviously there's usually some stressful event of some sort that can trigger depression. And then they do also mention here, though, which is interesting, and we'll mention this in the therapy chapter too, but they mention here that oftentimes major depression will come to an end on its own. All right? So people will eventually recover from depression. Once again, the vast majority of people will eventually recover from depression without seeking help. But when they do seek help, right, they tend to get over the depression faster and back to normal faster if they seek help, right? And that's going to be a thing they mention in the therapy chapter, the next chapter too, that yeah, psychotherapy works in that it seems to help people get over their problems faster, which is definitely a good thing. But the idea that most people who have depression will spontaneously recover eventually from that depression also gets back to that issue that I said a moment ago. Should this be listed as a disorder? Wouldn't it be natural for someone who lost a spouse of 4 years to be depressed for a while? They'll come out of it themselves. Why do we have to call it a disorder? Label that person with a disorder? Those are the larger issues, right, in all of this stuff. But I better stop this video there.